Hi everyone! In this video we want to discuss vitamin E and its effects on bleeding. We actually want to know that are we allowed to take vitamin E while on warfarin or other anticoagulants or not? The answer is maybe. It actually depends on the dose. Vitamin E, if taken more than 800 international units per day, may increase the risk of bleeding in patients taking warfarin or other anticoagulants. Maybe you say that 800 international units of vitamin E per day is much high, but that's not even true. You know that in some conditions like non-alcoholic fatty liver disease, the recommended dose of vitamin E is 800 international units per day. So this dose is kind of pharmacologic dose, and we warned about the increased risk of bleeding in doses greater than 800 international units per day, especially in patients taking warfarin or other anticoagulants. Another main point to consider about vitamin E is that studies have shown that in smokers, vitamin E has induced hemorrhagic stroke. So again, we warned about vitamin E and increased risk of bleeding. Hope you enjoyed this video. Please like, subscribe, and share and ask your questions regarding vitamin E in the comments. Thanks.